Hello and welcome to my channel. In this channel, we explain various nursing concepts in a simple form for a better and easy understanding. These videos could be used by both LPN and RN students as well as nurses who are trying to refresh their basic concepts. My name is Nasmosh. This is our introduction video to the nervous system. This is our nervous system series, and in this introduction video, we're going to do a rough pathology of the nervous system. We're going to talk about neurological assessment as well as diagnostic procedures used in relevance to the neuro system. So the nervous system includes the brain, spinal cord, as well as the nerves, and they all work together to collect, process, and disseminate information from the body's both internal and external environment. The nervous system communicates via a network of nerve cells which connect with other body systems. The brain monitors and controls these systems. The components of the nervous system include the brain, the spinal cord, peripheral nerves, as well as our sensory organs. So neurological assessment. So whenever we get a patient, we do various assessments. In our neurological assessment, we're going to talk about 8 specific things that we're going to be looking for or looking at when doing this assessment. So our first assessment will be a history of the present illness, right? Whatever illness the patient comes with, we need to know the history, when it started, how it's going, triggers, and all that kind of stuff. The second thing we're going to check will be the mental status of the patient, right? And with the mental status, it will be checking the cognition, the orientation, the affect, the LOC, which is the level of consciousness, the mood, as well as the speech. We're going to also assess the cranial nerves, right? And with the cranial nerves, there are 12 cranial nerves that we need to assess. Our first cranial nerve, the CN1, will be our olfactory. And with the olfactory, we are looking at our sensory and our smell. The second CN will be the optic, and the optic we're going to be checking on the sensory as well as the vision. The third CN will be the oculomotor, and it will be the motor and the eye. The fourth CN will be the tracheal, and it will be the motor and the eye as well. The fifth one will be the trigeminal, will be the sensory, face, motor, and chewing. Our sixth one will be the abducen, which will involve the motor and the eye. Number 7 will be the facial, which will include sensory, face, and hands. Number 8 will be acoustic, which will be sensory, hearing, and balance. Number 9 will be our gasopharyngeal, which will include the sensory and posterior taste. Number 10 will be the vagus, which includes sensory, throat, motor, swallowing, speech, cardiac inversion. Number 11, accessory, will be the motor, throat, neck, muscles, and upper back. And number 12 will be the hypoglossal, which will be the motor as well as the tongue. The fourth assessment will be our motor function assessment, and with the motor function assessment, we'll be assessing the muscles. With the muscles, we're checking the muscle tone, right? Are they flaccid? Are they rigid? The strength, how strong they are, the symmetry, right? And as well as the size. With the symmetry, we're talking about maybe a patient with MI, they'll be having the symmetry because, maybe paralysis on one side. Coordination, are the patient coordinated with movement? And with movement, we're going to check both involuntary and voluntary control movement. We're going to check out tremors, twitching, balance, as well as gait. Posturing. With posturing, we're going to check on flexion as well as extension. Our fifth neuro assessment will be the reflexes. And with the reflexes, we're going to talk about the reflex activity. With the reflex activity, it goes on a scale of 0 to 4, where 0 being absence of reflexes and 4 being the hyperactive, right? So the scale goes like this. 0 is absence of reflexes. 1, the reflex is weaker than normal. 2, the reflexes are normal. 3, the reflexes are stronger or more brisk, right? And 4, the reflexes are hyperactive. We're going to check on deep tendon reflexes, the DTRs for short, which include the triceps, biceps, quadriceps. We're going to check on superficial flex which includes abdominal, Babriskin, and platter as well. Our sixth neuro assessment will be our glaucoma scale, and our glaucoma scale has a scale of 0 to 15, with 3 being the least responsive and 15 being the most responsive. Most patients under 3 are comatose patients. We'll do a pupil check, right? And with pupil check, we always have to remember the acronym PARLA. And what is PARLA? PARLA is the pupil's reactiveness to light, right? And PARLA stands for pupils equal in size, round, regular in shape, and reactive to light as well as accommodation. Our 8th neurological assessment will be the vital signs. With vital signs, we'll be checking, blood pressure as well as pulse changes, because this may indicate an increase in intracranial pressure or brain intracranial pressure. So let's talk about diagnosis tests or diagnostic procedures. So our first diagnostic procedure we're going to talk about will be the lumbar puncture. What is a lumbar puncture? A lumbar puncture involves insertion of a needle into the subarachnoid space, and its function will be either to measure pressure, obtain CSF fluid, which is cerebral final fluid for analysis, as well as to inject contrast, anesthesia, or even certain medication. Some nursing considerations that you should be aware of when a patient or your patient is to undergo a lumbar puncture will be: always verify informed consents that have been signed. Have the patient empty their bowel and bladder. With this emptying bowel and bladder, we need a patient to be comfortable. We don't need them moving, because if you move, you can mix a nerve and you can damage the patient, right? You could lead the patient to paralysis. With the position, we'll position the patient on their side, knees pulled towards their chest and the chin tucked downward like a cradle position. Our work as a nurse during this procedure will to assist the MD in measuring pressure and collecting the CSF fluid if we were doing that. So post-procedural. So after the procedure is completed, the nurse should encourage the patient to increase fluid intake. We're increasing this fluid intake. Why? If we injected dye, we need to flush it out. We have to check the puncture sites for redness, swelling, and clear drainage, right? Clear drainage is what? If the CSF is leaking, redness and swelling are signs of infection. We'll also assess extremities for movement in case we nicked something, just to rule out paralysis, right? And we'll monitor for complications. The next diagnostic test that we'll talk about will be cerebral arterography. Cerebral arterography involves injecting a dye, usually via the femoral artery, to allow visualization of the cerebral arteries, right? Our nursing considerations. Before the procedure, informed consent. Without an informed consent, we cannot have the procedure. Your work as a nurse is to verify that the informed consents have been signed. You're not there to educate the patient on the procedure. If the patient says they do not know or they do not understand why they are signing the procedure, or they want to know more about the procedure, notify the MD. That is the job of the MD, to educate the patient on the procedure. Always remember that. If you see it in a test question, verifying the consents and to witness the consents being signed is your work during this kind of procedures. We are also checking for allergies to iodine, contrast dye, or shellfish. Remember, we are using contrast, and if patient is allergic to any of this, we can't do this procedure. We're going to send somebody into an anaphylactic shock. We don't want that. We're assessing the BUN and creatinine. Why? We need to know our kidney function. Why do we need to know our kidney function? We need to know the kidney function because we're introducing dye into the patient's body and we need the dye to be cleared out. So if we have a good kidney function, we know the patient will be able to clear out this dye. We'll keep the patient NPO for 4 to 6 hours before the procedure. We'll mark distal peripheral pulses. As well, we'll instruct the patient that whenever they inject that dye, they'll have this warm sensation, like something warm has entered their body. Post-procedure. After the procedure is done, what do? You should monitor the patient for any altered level of consciousness, sensory or motor. deficits, right? We introduce this fluid into the patient's body, we need to know. We check for bleeding or hematoma at the area of incision. Movement is restricted for 8 to 12 hours because any movement could increase pressure, could disturb any body normal homeostasis. And we also check for the peripheral pulses. Remember, we mark them. We check for color and temperature of the extremities. We need to know that there is sufficient perfusion to those extremities. We don't want this patient to lose their toes or extremities. The third one is going to be the CT scan. And the CT scan, what we should always know before the procedure, informed consent, always verify. Check for allergies to contrast, dye, and shellfish, BUN, and creatinine. And instruct the patient to lie still and flat, because this is what a CT scan is like a picture. When you move and shake, you're not going to have a clear image. So instruct them they need to stay still. After the procedure, we'll increase fluids to clear the dye out of the body system. We'll assess the dye injection site for bleeding, signs and symptoms of infection, right? And we'll also assess for any allergic reactions to the dye, because you could start having an allergy reaction even if you never had an allergic reaction before. The next procedure we're going to talk about is an EEG. So an EEG is a non-invasive assessment of electrical activities of the brain, where multiple rods are placed in the multiple areas of the scalp to detect activity and abnormalities. This is normally done with seizure patients. Just, they are put on it for 24 hours. It normally looks like, electrodes, and then they put like a mesh kind of hard to hold on it. So with nursing interventions with it, we'll verify medication that should be given prior to the procedure. Depressive stimulants and anti-seizure medicines are usually not given, because as I told you, mostly it's used for seizure patients. We need to see when the seizure activities are happening, and if we give the seizure meds, we're not going to know, right? So we'll instruct the client to avoid caffeine 8 hours prior to the test, right? Activity. We instruct the client to wash their hair prior to the test because it must be free of oil, sprays, and conditioners. Remember, I told you the electrodes are going to the head. We need that clean as possible just to have a good test. We need to verify if the test is being done awake, asleep, or sleep deprived. Always make sure what are the pre-procedure things that you need to do. Our last diagnostic test will be the MRI, magnetic resonance image, and with this, it's a non-invasive procedure, as we know, that uses magnetic field to contrast clear, detailed, cross-sectional image of the body. It's magnetic. Always remember that it's magnetic. So any metallic thing, the patient needs to remove it. So as a nursing intervention before this procedure or during this procedure, nursing interventions include: we verify that informed consents have been signed. We assess the client for claustrophobia, because remember, this thing is like a circular, like they're going inside like a concave like this. So if patient has claustrophobia, they're not going to be still. They're going to be moving. They're going to be tense, and you're not going to get the clear imaging that you need. We remove all metals, objects such as body piercing, jewelry, credit cards, and watches, because now they have magnetic credit cards, right? And no special test, diet, or medication are required for this. That's it for this video. We'll continue on the next one. Thank you for watching. Please like, share, and subscribe to my channel. See you on the next one. Bye.